Our lovely patient, who's 73 years old, is about a week out from her facelift, as well as her Lamina treatment, which is the CO2 lasering, microneedling, and nanofat rejuvenation. And we're sitting here looking at her post-op and pre-op photographs together, and she's very kindly agreed to share some of her thoughts and feelings about what she was hoping to achieve and how she feels so far.
Well, I'm very pleased because as I look at these pictures, I feel like I now no longer look sad, depressed, and tired. Now I look more like I feel, which is very happy to be alive, very glad to have a family, and very fortunate to have met Dr. Claytor to help me achieve that. Okay.
Well, it's great. No, there's no right or wrong way of doing it. You did very well.
Thank you.
As you look at these pictures from the side, what we're looking at is the side views. Share with everyone who's listening in what you're seeing.
Well, my before picture, I see someone that looks a little destitute, sad, but kind of like given up on life. Mm. And looking at my after picture, I feel more like me.
Yeah.
Like how I've always looked, I've felt. How I know myself.
That's what you hear so often, that people say,
yeah.
I just want to be me.
Yeah.
And do you feel that this helped you achieve that?
Absolutely.
Oh,
absolutely.
I love
Because I see the I'm just going to say the more vibrance in what's still inside of me, even at my age.
Yeah. I mean, you're 73 years young.
Yeah.
I mean, and to be honest with you, how old would you say you think you look in this picture?
Like
realizing that we're only a week out.
I look like I'm probably in my 20s.
I think that's a little over the top. I was going to say you look like you're in your early 50s. But because, please, people are never going to come and see me if they think I do a facelift and make them look 20. But you look youthful and age appropriate. Yeah. Age appropriate.
Certainly more vibrant and happy.
Yeah. Yeah. For sure. Share with everyone what the experience was like. Because we do this operation that we call it tumescent local anesthesia, and people, you're awake for this, and it's there's in your words, let everybody.
Being awake seemed a little challenging for me in the beginning because of just knowing what's going on. However, being able to participate with the doctor made me feel confident that he was able to perform his surgical technique better. So I was glad I was able to facilitate what he wanted me to do. Also, being awake made me realize kind of how intense everything that was being done to me, and it just gave me probably a larger understanding of really the magnitude of what was going on.
I think that's really well said, in that, again, I have no problem or reservation operating on patients under general anesthesia, but there are a lot of benefits to doing this under local anesthesia. I mean, you were headed home 15 minutes after we were finished. And then we were able to see you back the next day, and there are just a lot of positives at not having to undergo the general anesthesia.
When you're asleep, it's totally different.
Yeah.
Like it's like being awake. You're just really in the moment and understanding how, like I said, what the intensity of what you're doing is.
And how was the team? Did you find the team helpful?
The team, it was great. Yeah. Everybody was very friendly and lighthearted. Made me feel very, very well cared for, comfortable.
I love it. That's what we shoot for. What we shoot for. And then let's talk a little bit about your glands. You and I had discussed the submandibular glands and possible shave excision of them, and you had asked that we not touch them at all. And I think that what was very fortunate in your case is that your glands were very, very small. and were in fact largely up underneath your jawline anyway.
Okay.
So as you can see from your results, you have a beautiful contoured jawline, and it's definitely something that comes up. I was just talking with a gentleman earlier this morning who had very large glands, and he just totally had to have them out if he wanted any kind of improved jawline. But again, that's part of the pre-op evaluation to remember how we were, palpating your neck and your jawline to see if you did have any sizable glands, and you really didn't. So I was able to achieve these results by honoring your wishes.
Yes, and I'm happy for that because my understanding was that helps with preserving your taste.
Not your taste, but it makes a little saliva in your mouth, and sometimes people can complain of dry mouth. We don't generally see that, but you and I articulated it, and we came to that agreement together.
Yeah, no, very happy that they were salvaged.
Well, they were. We never take them all entirely, but we just take off a little bit of them. And again, this entire operation, this entire process is about meeting you where you are and educating you as to what it is that you were hoping to achieve and how I can get there, and what are the different elements that I need to employ to help you achieve that result.
Absolutely, and I think we made that goal.
For sure. Well, you look fantastic.
Thank you.
At a week, it's probably.
Take a picture of that?
Oh yeah, I can. I'll even take a picture of it and send it to you on your phone.
Okay.
But you're only a week, and do you go out to the grocery store at this point?
I haven't.
Okay.
No, I haven't. I probably will because I've taken everything out of the freezer that I could.
Cooked everything that's in there?
Yeah. And
I green light you to go out to the grocery store. Yeah.
No makeup now.
You can put a little makeup on centrally, but just not over your incisions.
Right. And what about the neck?
You can put a little bit over your neck, too.
Okay.
And just wash it off when you get home.
Oh, okay. And just put the nectar and the
and the balm.
And the balm and any antibiotic ointment on my ears or anything?
For another week, and then when you come back, we'll switch to scar cream.
Okay.
Perfect.
Okay.
Well, thank you so much.
Thank you.
The question I always like to ask people at the end of this is this something that you would recommend to a friend?
Oh, absolutely. Sure. Anybody that wants to achieve the feeling of wanting to look a little more youthful, there's such a thing as aging gracefully, but you can also age gracefully with a little bit of help.
I love that. So beautifully said. Yeah. Well, thank you very much.
Thank you.
You're welcome.
Dr. Claytor, absolutely.